Why use nonverbal communication with dementia patients? Imagine trying to tell someone how you feel but not being able to find the right words. That's what many people with dementia experience as their language skills decline. As dementia progresses, speaking clearly or forming sentences can become very difficult or even impossible. That's where nonverbal communication becomes so important. It includes gestures, facial expressions, body language, touch, tone of voice, and visual cues. These methods help the person with dementia express their needs, feelings, and maintain social connections even when words fail. Dementia affects how the brain processes language, which makes talking a challenge. Using nonverbal cues allows caregivers and loved ones to connect in meaningful ways without relying on speech. This can reduce frustration and anxiety for the person with dementia, helping them feel calmer and more understood. It also helps prevent feelings of loneliness or isolation that can happen when communication breaks down. One key reason to use nonverbal communication is to compensate for the loss of speech. When words are no longer easy to find or form, gestures and facial expressions become the main way for the person to show what they need or want. For example, a smile or a nod can indicate agreement, while a frown or a look of confusion can signal discomfort or misunderstanding. Gentle touch, like holding a hand, can be very reassuring and convey comfort and empathy. Nonverbal communication also helps reduce distress. When a person with dementia feels scared or confused, a calm tone of voice, a warm smile, or a gentle touch can provide reassurance. These cues help them feel safe and cared for. Using simple gestures and slow, clear speech can also make it easier for them to understand and respond, even if they cannot speak well. Engaging with nonverbal signals encourages social participation and supports the person's sense of identity. It allows caregivers to discover what the person still wants to communicate and helps maintain their dignity. For example, pointing to a favorite object or using visual cues like pictures can help them express preferences or needs. This kind of interaction keeps the connection alive and reminds the person that they are still valued and understood. Supporting emotional bonds is another vital reason. Nonverbal communication shows empathy and presence, which are essential as verbal conversations become less possible. Maintaining a contact, smiling warmly, and using body language that shows attentiveness help strengthen relationships. These gestures demonstrate that the caregiver is truly present and cares deeply, which can boost the person's mood and sense of security. In daily life, practical steps include being patient and giving the person time to respond. Using touch appropriately, like holding a hand or patting a shoulder, can be comforting. Limiting choices helps avoid overwhelming them, and maintaining eye contact or smiling can make interactions more positive. Using gestures like pointing or nodding, along with slow speech, helps the person process information more easily. Creating a calm environment and being consistent in your approach also support better understanding. Overall, nonverbal communication is a powerful tool in managing daily life with dementia. It helps improve interactions, supports emotional well-being, and preserves relationships even when words are no longer enough. Remember, each person is unique, so paying attention to their individual cues and responses is key. Always consult healthcare professionals for personalized advice and support, and approach every interaction with patience, kindness, and respect.